welcome back to my channel. My name is Isolona, and on this channel we create contents on faith, on nursing, on health, as well as makeup. If these are the kind of contents you're looking out for, please do not hesitate to like, to share, as well as subscribe to the channel. Now, in today's video, we're going to be looking at the importance of ultrasound scan during pregnancy. The reason why I felt the need to film this is because I've had a lot of patients in their bid to save cost. They will tell you outrightly that they do not want to do scan during pregnancy. And my response always is, after telling them the importance of the scan, I will also go ahead to tell them or ask them which is more expensive, getting pregnant or doing the scan. That's the question I always ask, because I believe if you are thinking of, oh, you don't want to do scan, there are a whole lot of things you're going to do for that child. All right. So some patients don't seem to understand the importance of scan. For ultrasound scan, as far as I'm concerned, there are reasons why you're being asked to do them as a pregnant woman, and there are certain consequences that may occur if this scan is not being done with you. Now let's go straight into the video. Now, first off, what is an ultrasound scan? Now, an ultrasound scan is a medical procedure that makes use of sound waves to create images of your baby or your babies on a screen. And I'm talking in terms of pregnancy. Now, there are several importance of ultrasound scan. One of them is it serves as a means of assessing the fetal heart rate, the fetal growth, as well as the fetal movement. It also monitors the overall health of the baby all through the period of pregnancy. Another importance is that it examines the amount of amniotic fluid present in the uterus. Now, amniotic fluid is that fluid that the baby in the uterus is swimming in. Okay, now when a woman, it's time for a woman to deliver, one of the signs of labor that the woman might experience is water breaking. Okay, what you call water breaking. So that water is the amniotic fluid. That's what we call the amniotic fluid. All right. Now, through the ultrasound scan, you are able to assess the amount of the amniotic fluid present in the uterus, because when it's too much, there's a problem, and when it's too little, there is a problem. It ascertains the position of the placenta. Now, this is very important because when it comes to vaginal birth, okay, vaginal birth is only possible when the placenta is not lying directly in front of the baby. So it is through the ultrasound scan we're able to tell that, oh, the placenta is where it's supposed to be, and this placenta can vary, and the position of the placenta can vary depending on the condition as at that time. It also predicts the estimated due date of delivery. Now, this estimated due date is what we call EDD. Okay, now it's able to tell you around what period of time you would deliver your baby. Now, one thing with the scan is it doesn't give you the exact date. Okay, it's usually a plus 2 weeks minus 2 weeks time frame that it gives you. So if you write a particular date, 2 weeks before that time, 2 weeks after that time, which is always indicated in the scan result, that is when you are most likely to have your baby. All things being equal. It also helps you to determine the gestational age of the pregnancy, that is how old the pregnancy is, especially for women that when they come to the hospital and you ask them their last menstrual period, they are not sure. There's some women who are not sure. Oh, it was this month, or was it this month? I don't know. Do you understand? Now, another importance of ultrasound scan during pregnancy is it helps to ascertain the position as well as the lie of the fetus. Now, this is very important because it goes a long way in telling you whether or not surgical intervention will be needed during the course of the pregnancy. Because for someone whose baby that the position and the lie is wrong, the person might not be able to give birth vaginally. Okay, so that person might end up going for cesarean section. So that's one importance of the scan. Another importance of the scan, it helps to measure the length of the fetus. What we call height as an adult, you're trying to check what's your height, is the length in utero. So the ultrasound scan helps you to detect, okay, what's the length of this fetus. All right. Finally, it helps to detect any form of anomaly in the fetus. Now, from the ultrasound scan, you can tell if this fetus or this baby's head is twice as large, if the neck is twice as thin, if the hands are twice as large. Okay, now it's going to help you to detect if there is anything wrong with the fetus for quick and easy intervention to be carried out. Now, note that during the course of your pregnancy, that's for the 9 months, you will be asked to provide at least two ultrasound scans. One is at the onset of the pregnancy, and the other is at the latter end of the pregnancy, depending on how your pregnancy progresses. Meaning that because of the condition that arises during the pregnancy, they might be asked to even do more than two scans. Some person might do three, four, five scans, whatever the case may be. But at least two scans is usually asked of you during the period of your antenatal. Okay. Now I hope I'll be able to educate us on the importance of ultrasound scan. So for mothers that are saying they don't have money for scan is not important. The last pregnancy, the last child I gave birth to, I didn't do scan is not correct. My dear, it doesn't have to be important to you, but we need it in the hospital. We need it because scan is going to serve as a guide to us in taking care of you all through the period of your pregnancy. If you have any questions or recommendations, or if there's any importance of ultrasound scan that you think I left out in this video, please leave it in the comment section down below. Till I see you next time, bye, love, and God bless you.